When I think about our organization and all the people that contribute to the care that's provided in our facilities, I can't help but think about how important the role of the nurse is.
Good morning.
I think the professional practice model is an unbelievable tool to help empower our nurses.
Deep breath.
The professional practice model really is an opportunity to leverage the talent of the nurses to their highest level of performance so that the nurses really are in an environment where they not only produce excellent outcomes, but they really have the joy of nursing as part of that journey.
How you doing?
And this is their practice model. They have really thought this through very carefully. And when we came up with our practice model fostering partnerships, it was very clear that those partnerships are really going to get us to those superior patient outcomes.
Discharged, that's it.
Without our staff, we're a building. And it's not our building that calls people to come to us, it's the people inside the building that create the magic.
We needed to have a way to solidify how we collaborate, how we communicate, and how we develop ourselves as professionals.
We wanted something that every nurse could grasp and say, this is what drives our nursing practice. This is what makes us mainline health nurses.
The picture and the acronym really helps me to explain to my patients what it is that I do for them every day.
It'll unify us, nurses at Riddle, at Bryn Mawr Rehab, at Bryn Mawr, at Lankenau, at Paoli, all together.
Making a difference together, every day.
And that's what our professional model will help us to do. Make that come alive every single day.
Morning.
The nurse residency program was instituted to help that transition from books and school to the first year as a nurse, because it truly is a difficult time to make that transition.
Good.
Gives you a good sigh of relief to know that you're going through the same thing as they are.
There's somebody that you can go to other than somebody on your floor.
I think the nurse residency program has really helped me to communicate more effectively and make a close-knit partnership with the mainline health.
We'll be getting you out of here today.
The project at Riddle Hospital started several years ago when we were trying to improve obstetric outcomes.
Condition O is related to a woman who is still pregnant and she and her baby are in some sort of distress that we need all hands on deck.
Yes, could you please call Condition O?
We asked people to speak out and say what they want, what they need, what they think is going on.
It had to be a team effort, that everybody had to be responsible and accountable for their role in every Condition O.
All right, stop pushing for a second. We had a 24-year-old young woman already here in labor expecting her first baby. The nurse called out for a Condition O. People came to our aid from all over, just as we had practiced. I saw her just a few weeks ago and asked her how she was doing. And she said to me, I don't know what more you can look for superb care other than saving my life and my baby's life.
Nurses are critical to the research process. The design of the course was to give them 2 weeks where they do nothing else but intensive study of research and research design.
Definitely you're going to be using more of your critical thinking skills and just taking a step back as opposed to viewing your shift as a list of tasks that you have to get done.
So it's the same thing.
I think on the floor day in, day out, you might not think about it that often, but it is what transforms our care and moves us to better practices.
Well, in the orthopedic unit, the teaching begins before the patient even comes to the hospital.
They come in before their surgery, they get their education. Then while they're here, they're educated by the nurses in the room. They go to the gym, they're educated with the physical therapists and the occupational therapists. So it's a process that is hospital-wide on our floor.
I think the patients that are educated ahead of time and know what to expect post-operatively have better outcomes.
Really good.
To actually be able to have the opportunity to design a whole building is really a once-in-a-lifetime opportunity.
I was included in the design of the building pretty much from the get-go.
The nurses got to partner with the architects, and that was very important for the architects to hear what actually goes on at the bedside.
We are so pleased with how it turned out. We can see the input that we had just come to fruition.
The building itself will not provide better care. It's the staff. But if we give them better tools and a better environment to work in, hopefully that will make their job a little easier.
She came yesterday to us. We decided that ventilator-associated pneumonia had been an issue, so we initiated a process to help eliminate or decrease our rates.
We then gave some feedback. We gave that verbally, we gave that in email, we gave that in educational sessions.
I think our biggest idea that we had was initiating daily data collection.
Through this performance improvement initiative, we have been able to engage each individual at every level of the organization and make an impact.
Yeah, CVP is not real high.
It's good for the nurses to see that our hard work really does pay off.
Put the walker down first?
Yes.
As soon as you enter the facility, you can tell that they're all working together.
Our goal is to come together and advocate for the patient and be a communicator to the rest of the team.
There's nobody does it on their own. It's an entire group that has to work all together. So we're very fortunate. We have a good group.
Nurses are integral in achieving the outcomes for our patients. They empower them, they enable our patients to achieve their goals, but what they ultimately do is help towards restoring quality of life for our patients.
They cheer you up and they get you started and encourage you. Keep pushing, you're getting there.
And she's getting there.
Just a thank you note, again, from the bottom of my heart, for the tremendous care and concern you showed for my husband's recovery in ICU.
I simply want you to know of my great satisfaction with the care and therapy I received at your hospital.
If this team was a football team, you would win the Super Bowl every year.
All of you were an incredible comfort and blessing to my family.
What can I say, day after day, night after night? What I heard was, can I help you with that? Are you all right?
I wanted you to know how great the care made me feel.
The smiles, the friendly words of encouragement, the gentle urging.
There must be a special place in heaven for these kind, generous, unselfish people, and it has been my privilege to have met them, and I thank them for the strength they gave to me.
Thanks from the bottom of my heart.